Saudi Arabia announced 8 new deaths from the MERS coronavirus, taking the kingdom's death toll from the disease since it was discovered in 2012 to 102. Newsfirst delves deep into the story.
Middle East Respiratory Syndrome, also known as MERS, broke out in a number of Middle East nations in 2012. It is considered a deadlier but less transmissible cousin of the SARS virus, which erupted in Asia in 2003 and infected 8,237 people, 9% of whom died. The World Health Organization says that in the case of the MERS virus, a third of the patients fall prey to the disease. Experts are still struggling to understand the MERS virus, for which there is no vaccine. Symptoms of MERS include fever, cough and respiratory ailments. The World Health Organization announced that it had offered to send international experts to Saudi Arabia to investigate any evolving risk associated with the transmission pattern of the virus. A recent study in Saudi Arabia said that the virus has been extraordinarily common in camels for at least 20 years and it may have been passed from the animals to humans and has now evolved. The Health Ministry of Saudi Arabia said that the number of recorded infections had risen to 339, with 143 cases announced since the beginning of April, representing a 73% jump in total infections. A total of 16 patients have been infected with the virus during the last 24 hours in Saudi Arabia. The acting health minister has designated 3 hospitals in Riyadh, Jeddah and Dammam on the Gulf Coast as specialist centers for MERS treatment. King Abdullah earlier this week sacked the country's health minister over his handling of the situation. Meanwhile, here in Colombo, a meeting was held at the epidemiology unit of the Ministry of Health on the safety and security of Sri Lankans travelling to Middle East countries in light of the MERS virus outbreak.
The Ministry of Health and the Sri Lankan Foreign Employment Bureau held discussions with the epidemiology unit in this regard. The Ministry of Health informed us that a clear program has been undertaken. We will provide our fullest support. So far, no Sri Lankan has been infected with the virus. We have not received any positive cases yet.
The Ministry of Health has focused its attention on preventing any possible outbreak of the virus in Sri Lanka.
We have informed foreign employment agencies and organizations regarding the outbreak. We are also taking steps to inform Sri Lankan expats working in the Middle East about the disease, especially those who intend to visit Sri Lanka. We have asked them to consult a doctor if they have fever or other symptoms. We have taken the necessary immediate steps. If the situation aggravates, we will have to discuss the matter further.